This is not an event, I think most of you know this, but this is not an event for us to talk about whether we think the Affordable Care Act is a good idea. What we're doing here tonight is we've got Giovanni Gomez, who's our regional director for Get Covered Illinois, which falls under the Affordable Care Act. That's the name for it in the state of Illinois. And we have people talk about it so you understand how it works. And then we have people here tonight that can answer your questions, that can help you. They're in the back, and help you figure out how to navigate this new system. So we're really excited that you're here. This will not be, we will do several of these. This is our first one that we're doing in district, but we'll do several of them. You know, you have till December 15th to get signed up, but I'm going to introduce Giovanni because he can give you a lot more detail than I can. And if there are any questions, I'm happy to answer them quickly.
Are you going to take questions during the presentation?
Will we take questions?
Yeah, sure.
Absolutely.
Yeah.
Yeah, this is really informal. The only thing I wanted to be clear on is that we're not here to debate whether the Affordable Care Act is a good idea. We're here to answer serious questions about how do I get covered, how does this work for me? So we're thrilled to be here. We're happy to see you here tonight. And Giovanni, come on up. Thank you so much for being here.
Hello everyone, my name is Giovanni Gomez. I'm the regional coordinator for the Get Covered Illinois. This is our initiative, our initiative for Illinois as far as the Affordable Care Act in the marketplace. And if anything, what I'm going to be talking about as far as the Affordable Care Act is what's going to be happening, what's happening now, what's going to be happening, what's happening on January 1st, what is the marketplace, and I know 80%, this information that I present is really going to be 80% of the information. 20% of the information really comes down to an individual level, and how does it affect me, how does it affect my family, how does it affect the people around me more than anything. So if anything, can everybody see this? Everybody? Is it visible? Is it visible for everyone? If not, I recommend to move a little bit. I know the projector's in the way. Good to go. All right. So if anything, very, very important. In 2010, President Barack Obama signed the Affordable Care Act into law. Now, it creates two things. First of all, it creates, one of the things why it was created was because health insurance has been literally inaccessible. It's been inaccessible because it's been unaffordable. Right now, we have over 1 million people in the state of Illinois who are uninsured. And it's simply not because they chose, there is sort of certain reason why those individuals, it's not that they really didn't want insurance, there hasn't been really an accessibility to them. It hasn't been affordable. The cost of getting health has actually been, to buy health insurance has actually been growing a lot faster than even the inflation of the dollar. So it creates affordability, creates accessibility, and one thing actually about the Affordable Care Act that does go into effect is the creation of the marketplace. The marketplace itself, and we'll talk about what it really is. If there's two things that I want to emphasize, it's A, open enrollment has already started, and B, open enrollment has started since October 1st and will be continuing all the way to March 31st. It is a 6-month process. 6 months to get enrolled and get plenty of information. The month of October, we are concentrating on education, education, and education. We know this is new to many people, and a lot of people are trying to see what's coming up, how does it affect me, what are my plan options. So we'll talk about right now. One of the things is what the Affordable Care Act does now. Again, it's already passed in 2010, it goes into full effect in 2014. We're already in 2013, it's already coming into full effect. One of the things is that it extends dependability for children, for young adults to be on their parents' group plan up to the age of 26. Now, this is huge, because what would happen before is when you maxed out at age 19 on your parents' group plan, you were automatically dropped. No questions asked, you were dropped, and you were an individual who probably just got out of high school, still trying to look for a job, or going to college, and you were left without health insurance. Still, health insurance is too expensive for an individual going to school. So now, what's eligible for them is for them to be on their parents' group plan up to the age of 26. Another thing is that right now, children with pre-existing conditions cannot be denied coverage. Very, very huge. And we'll get into a little bit more into the pre-existing conditions, but right now, before January, children cannot be denied coverage because of pre-existing conditions. Another thing is that there's the elimination of lifetime and annual limits. What really does that mean? What it really means is, let's just say, for example, an individual had cancer. Well, I don't want to propose nothing bad on that individual, but life happens sometimes. So that person that has cancer has to pay for prescriptions, has to pay for the doctor, has to pay for chemo, has to pay for everything that goes around with getting those services. However, what would happen is that in an insurance company, when you buy insurance, there's an annual limit of how much actually they'll spend on it. So once you reach that cap, you get dropped right away. You're automatically dropped from your plan. And so now what would happen to an individual is they still have to pay medication, they still have to pay to go see the doctor, they still have to go to the hospital and everything that comes with it. And on top of all that, they also have to find insurance. And they have to try to find an insurance that will actually accept them because they have that pre-existing condition as well. So however, that is no longer the case. There is the elimination of lifetime and annual limits. Even if you reach that cap, they are still providing services to you. Another thing that's happening is preventative care is covered. Those checkups, those mammograms, those once-a-year checkups, twice-a-year checkups, those are covered with no out-of-pocket cost to you. So there is no copay when you go into these services as well. Another thing is that there's the implementation of the 80-20 rule. This 80-20 rule states that for every premium dollar that a consumer spends, 80 cents actually has to go towards your health. Now, what was happening before is that companies were spending 40 cents, 50 cents on your health, and the rest were going actually to administration costs. That is no longer the case. Now, for every premium dollar that you're spending, 80 cents actually has to go towards your health. And if it doesn't go towards your health, it either has to be reimbursed towards consumers, or they have to bring premium prices down. So we talked about, this is what's actually happening now, but however, it's also important to take into consideration what's happening in 2014 on January, when the Affordable Care Act actually goes into effect. One of the important things is that no longer can their premiums be discriminated because they're a man or a woman. That's very, very important. Simply to take into consideration, a younger woman would have a higher premium than a younger man. Unfortunately, women would need more services, and an older man would need more services when he gets older. So they would be able to discriminate. But however, that is no longer the case. Whether you're a man or you're a woman, they cannot discriminate because on you because of your gender. Another thing that's happening is 2014, as many of us know, is that beginning on January, no one, adults or children, can be denied because of a pre-existing condition. That's going to be very, very important. Simply, some people have been denied coverage, or their premium prices have gone up because of that pre-existing condition. And no longer can they be denied, but also they cannot be discriminated because of that pre-existing condition. Another thing is that there's the extension of Medicaid. Now, what we know as Medicaid is literally, Medicaid covers children under a certain income, pregnant women, covers also adults under a certain income, and people with disabilities. The only group that was not actually covered was adults without dependents, regardless of their income. However, through legislation and through the Affordable Care Act, Illinois took the choice to extend Medicaid towards adults without dependents. So now even adults without dependents with under a certain income will be eligible to get Medicaid. And another thing is the creation of the marketplace. And again, open enrollment has already started, and it will continue to all the way to March 31st. And it really goes up to us is, what is the marketplace? What is this? What is it? Now, to really get a good hold of what the marketplace is, it is literally a tool. That's what it is. It's a tool. If many of us have already used Expedia or Travelocity to search flights, what you do is you enter your information, you enter where you want to go, and it literally gives you all these private companies that are there. Americana's there, Continental's there, and that's what it really is. Expedia and Travelocity is a tool that puts consumers and air flights all in one area, and that's what the marketplace is. It literally is a tool that puts consumers and it puts private companies all in one area. Now, it's a place where individuals are going to be able to purchase insurance, families are going to be able to purchase insurance, and as well as small businesses. Now, we're not going to talk about small businesses right now. That's a different subject for another time. We'll talk about the individual level, as far as families and individuals. So the ways that you're going to be able to apply online, you're going to be able to apply online through the phone or actually through paper. We don't really recommend paper, but paper will always be available for you. We definitely want to make sure you get these services right away. Another thing to take into emphasis is when it comes to phone. No one should ever be calling you to get signed up through the phone. If anything, the consumer should be calling the marketplace. It should be the state, or they should be calling the federal government, the two numbers that we have in regards to getting this health insurance. No one should ever be calling you. We've heard of fraud. Unfortunately, it's happened much to seniors, and we are working very, very closely with the Attorney General's office to make sure we show accountability for these individuals creating this fraud. There will also be an ability to sign up in person. We have our in-person counselors right here, also known as navigators. However, they are located all over Lake County. We'll talk about what our Illinois system program is. So how is it literally going to work? It is literally a one application process where you're going to be able to enter your information, and it's going to tell you either this is what your tax credits are. But before I actually talk about that, I want to talk about getcoveredillinois.gov, our website. Our website has a screening tool, very, very important screening tool, because what that screening tool really is, it's going to ask you basic information. What is your family household size? What is your family income? Is anyone in your family already on Medicaid? Do they have insurance? Because this screening tool is literally either going to take you to, based on that information you enter, it is literally going to take you to A, the marketplace, or it's either going to take you to B, ABE. ABE is called the Application Benefit Eligibility. That is the new website where people with Medicaid are going to be able to apply for it. So based on your information, it'll take you to one or the other. Now you are going to be able to, if for some reason you are sent to ABE, and through filling out your application, we end up finding out that you are supposed to be going to the marketplace. It will literally transfer your application from ABE to the marketplace. However, to avoid this problem, to avoid some lag time, that's why we have our screening tool, to get you to the right location the first time. Even though we talk about the marketplace, it's very, very important to know who actually qualifies for the marketplace and who are going to qualify for these benefits that come along with the marketplace. It's very, very important to know. So you have to be a U.S. citizen, U.S. national, or otherwise you actually have to be legally present in the United States to be able to get on the marketplace. And that's just the marketplace in general. Now you cannot be incarcerated. And very, very importantly, you have to be a resident of Illinois. If for some reason, because this is Lake County, you work in Illinois, but you live in Wisconsin, you go to the Wisconsin marketplace. The Wisconsin will have their own marketplace. If you live in Florida, the Florida marketplace will be for you. However, if you are in Illinois, you will be going to our marketplace and the plans that are available to you.
Excuse me, is lawfully present, what does that mean, lawfully present during the enrollment period?
Well, yes.
Does that include illegal aliens?
No, as long as they're residents here, legally present residents, they will be eligible to get on the marketplace.
Does that include illegal aliens that may be present here, but they're illegal? No,
they cannot get on the marketplace. I mean, I guess it's really nitty-gritty about what's legally residing and what's not legally residing. But if you are undocumented, you cannot be in the marketplace, nor can you receive the credits available to you. So one thing about this Affordable Care Act, about the marketplace, and again, the emphasis of affordability and the benefit of actually going into the marketplace is these tax credits are actually available to you to help you pay your premiums. Very, very important. Now, if you are between the 100% and 400% of the federal poverty level, you are eligible to get tax credits to help you pay your premiums. Now, I don't want to get into the federal poverty level where you fall, because then we can literally spend an hour talking about the federal poverty level. An important thing to know is that it is based on your income and it is based on your family household size. And the great thing about it is that the website's going to do all this for you. So you're not going to have to find out, hey, am I in the 200%? Am I 350? Am I 100? No, I mean, it's all dependent. Because one individual making, let's just say $24,000 a year, they might be put in the 200% of the federal poverty level. But a family making that much amount of money, the same amount of money as one individual with a family household of 4, might be in a different federal poverty level. So it's different. It's all depending on your income, and it's all depending on your family household size. Very, very important. And we'll take an example of exactly how that's going to work. But based on where you are on that scale, that's exactly what your tax credit is going to be based off of. And you have to be a citizen, you have to be lawfully present here. And there are, for residents, it's very important to know that residents in the state of Illinois, it gets really complicated if we talk about this, but if you are a resident and you haven't been here longer than 5 years, you are not eligible for some parts of Medicaid. So if for some reason you're not eligible for Medicaid and you're still a resident, you're still able to go to the marketplace. And if for some reason you are in the 90% of the federal poverty level, we will boost you up to the 100% to be eligible for tax credits automatically. So this is a quick wrap. I don't want to emphasize on it too much. The red is actually the Medicaid that is happening now. That is Medicaid. As you can see, children, pregnant women, parents, people with disabilities, that is the Medicaid program that we have now. So if you fall, for some reason, in these categories, you're on Medicaid. The blue section is actually the new extended Medicaid that will begin on January 1st. These are the new individuals that will be eligible to get on. Now, if for some reason you were to fall in the yellow section, the marketplace, you will be eligible for tax credits for your premiums. If for some reason you are above the 400% of the federal poverty level, you are still eligible to go to the marketplace. However, there will not be any tax credits available to you. Very, very important.
Just a simple question, just so we can be very clear. If the federal poverty level is $1 and I make $4, does that mean I'm 400% above the poverty level? Just,
yeah.
I'm not sure what that
Yeah.
is.
So like to put an example, I think the 138 of the federal poverty level is like 14 and some change for one single individual. So if you were, or it's like 11 or somewhere around there. Let's just say you make $50,000. $50,000 for one individual is well above the 400% of the federal poverty level.
4 times.
Yeah, exactly. So one of the things is there's nothing stopping you from going to the marketplace. The marketplace will always be an additional tool for you. However, there will not be any tax available to you as well. So that's very, very important to know. And as you can see, one thing I did want to mention is, as you can see, if you do apply as a group, there might be an opportunity that you as a parent may fall into the marketplace, but your children may fall into Medicaid, into the all kids. Simply because, as you can see, the all kids, the federal percent of the percent in the federal poverty level is very high, very, very high. So one thing, it's a difference between us. We're creating affordability, we're creating accessibility towards the general public, but another thing is that we also want to make sure that we provide quality insurance to the individuals. Now, in order to assure this, part of the Affordable Care Act is that every single plan sold on the marketplace, it has to have 10 essential health benefits. These are the 10 essential health benefits that is guaranteed every single plan in the marketplace will be covering. Now, this is maternity care, newborn care, prescription drugs, emergency services, mental rehabilitation, substance abuse rehabilitation. Now, as you can see, all 10 of these are guaranteed to have in the plan in the marketplace. They will all be there. And these are the 10. I don't want to go too much into them. So some way, somehow, each and every single plan will be covering these 10 essential health benefits.
Quick question. Do you have this in like a booklet or something that we would have, or can you email the PowerPoint?
I'm more than happy to provide it to Senator Melinda Bush's office, and they can be more than happy to share it. So what really goes into the nitty-gritty about these plans is these plans are also distributed into metal plans. These metal plans, they're based on actuarial values. The actuarial value is more of an insurance thing of what actually goes into your insurance plans. But to put it in a simpler version, these plans are distributed between a platinum, a gold, a silver, and a bronze. And I know it says benchmark plan, and we'll talk about why a silver plan is because it's going to be considered a benchmark plan. But to put it more better in perspective, it's important to notice that yes, a platinum plan is a better plan. It is going to have more gist to it, it's going to have more onto it. A bronze plan will not have the same quality as a platinum plan, but it will also cover the 10 essential health benefits. But the really gist that comes into it is yes, a platinum plan is going to have a higher premium. However, the co-pays, the deductibles, the out-of-pocket costs will be lower. The bronze plan, the premiums will be lower. However, the deductibles, the co-pays, the co-insurance will be higher. And in a way, it gives a consumer a choice of what exactly insurance they want. Myself, I hardly go to the doctor. I think I go like once a year. I go to a checkup here and there whenever I'm sick, and they really tell me you have to go to the doctor, otherwise I don't really go. That maybe when I go to the marketplace, maybe a bronze plan is best for me. Because I'm okay paying a lower premium, but yes, you know what, my deductibles are higher, my co-pays higher, my co-insurance, or maybe I'm an individual who goes to the doctor 3 or 4 times a month, and maybe I'm okay paying the higher premium, but I'm okay assuring that the out-of-pocket costs, the co-pay, the co-insurance, everything, those unexpected costs are lower. That's in a way to put it into perspective what plan is right for you. There will be catastrophic plans. These catastrophic plans are available. They are more for what we call the young invincibles, the people who believe that they don't really need insurance, but they have to get insurance. Catastrophic plans are literally safety nets. They're safety nets for the unexpected accident, the unexpected injury, and yes, they will have a lower premium. However, the co-pays and the deductibles are a lot higher, and they are only available for A, if you are under the age of 30, and B, if you are below 250% of the federal poverty level. That is the only way that catastrophic plans will be available to you. So I do want to give an example of exactly how this is all going to work. So we're going to have John. John's 24 years old. His income is $22,980. That would literally put him at the 200% of the federal poverty level. One individual, one income. His expected contribution for him to pay for his premium is 6.3%. That's $1,448. That's what his expected contribution are. Now let's just say for some reason, the plans that are offered to him is a gold, a silver, and a bronze. Now, these are not official prices. I don't want to scare anybody. Well, before I start, these are not official prices. I know we're all dying for them, but these are not official prices. So let's just say between the gold, the silver, and the bronze, there's a $200 difference between all of them. And the silver is $5,000. Now, John, for this example, is going to choose a $5,000 silver plan. However, what he's expected to contribute is $1,448. So what his tax credit will be, it will be $3,552. That is a tax credit that John is going to get to help him pay his premium. Now there is 2 ways John, when he goes into the marketplace and he decides that's his tax credit, that's a plan that he's choosing. There are 2 ways that John is going to be able to get this tax credit. Either A, John is going to have the choice to pay his monthly premium every month, $5,000, and receive his tax credit at the end of the year when he files taxes. That will be his choice. The marketplace will give him that decision. Or what's going to be available to him is that John will be able to decide to take this tax credit early. What that really means is, for example, let's just say John's premium price for the month was $250. Well, he wants to take his tax credit early. So instead of paying $250, he's actually paying $180 or $200. That's how he will have that choice to take that tax credit early on. Now, John will not receive his tax credit up front. He will see it directly into his premium price. And so he will directly pay that $200, and those $50 will come from the federal government and pay the insurance company. So he will never see that.
Where's this money going to come from? Right now we're at debt ceiling, we're broke as a country. It looks like a nice deal that people can get these tax credits.
Sorry, I'm gonna
Where are
interrupt.
they coming from?
I really have to interrupt. We're not gonna answer those kind of questions. I don't mean to be
Well, that's
rude.
not a legitimate question.
It's not, I don't think it's for this, do you?
We'll-
Are you comfortable with that?
We'll,
Can we answer
let
that
me,
after
yeah,
offline?
let me
Yeah.
finish real quick and we'll talk about
We're
this.
happy to. I just don't
So
wanna.
this is not an open meeting, is what you're saying?
Of course it's an open meeting, but it's not a discussion about whether, how it's being paid for. That's for another time. This is really
Would you
about,
buy something without knowing what it's gonna cost?
absolutely, that's what you're gonna be able to find out.
Okay, well, I'll talk about it just a little bit.
Okay, all right.
I want to thank you for interrupting the question. because
Thank you.
I didn't feel it was appropriate.
So, why it's a benchmark plan is very, very important. Simply because no matter what plan you choose, the tax credit never changes. It literally never changes. If you decide to buy a gold plan, and that gold plan is $200 more, the consumer will be paying $200 more. If the consumer decides to purchase a bronze plan, that consumer will pay $200 less. No matter what, based on that benchmark plan, that is what your tax credit is being based on. So, does everybody get the groove of that one? Good. Like that's why it's very, very important to know that why that silver plan is a benchmark plan. So you can take the choice to to get a better plan. However, it will cost that consumer more. So now we know that individuals and families will be eligible for tax credits. But another thing is that consumers between the 100% and the 200% of the federal poverty level, they will also be eligible for cost-sharing subsidies. What these cost-sharing subsidies really are is an assistance to help you pay for those co-pays, for those deductibles. So they will be a lot smaller. You'll see it directly in your price. So instead of paying a $20 co-pay, maybe you're paying a $10 co-pay instead. So those services will be available to you, and it's on a sliding scale. Everything's on a sliding scale depending where exactly you fall into the scale. And there will be consumers also can receive a cap of how much out-of-pocket spending there will be as well. So one thing to take into consideration and one thing to be very, very cautious of, and I believe that everybody should know, is that those who receive employer-provided insurance that meets the Affordable Care Act standards of value and affordability, they can apply for the affordable. They can go into the marketplace. However, there is no tax credits available to you. Very, very, very important. I can't emphasize how important this is. So if you are receiving insurance from work and it has a value, that means it has a minimum value of 60%. And again, we do have a toolkit, a worker's toolkit, to help you decide where your plan stands by, if it meets the Affordable Care Act standards. If it's affordable, then you don't have to, but it's preferred that you take your plan from your job, where you're getting it. Because if you do go to the marketplace, that's fine. There's nothing stopping you. There's literally nothing blocking you. However, there are no tax credits available to you. Very, very important to know. So we talked about the Affordable Care Act. We talked about how all this program is going to work, how we can see that these services are available to you. But however, it really, some individuals need a little, some of us as consumers, we need a little bit more. We need assurance. We need a little bit of help about how do we fill out this question. I have this certain situation, how is this going to affect me? How can my son apply? How can my daughter apply? How can a brother apply? And what we have set up is the Illinois Assister Program. Now, one thing to take into consideration is that yes, we are creating accessibility. We are creating affordability. We know that we have over 1 million people receiving, we're creating that accessibility to over 1 million people. However, what we're also creating is a culture of coverage. That culture of coverage is literally going to take a lot of education as far as creating a social norm as where it is possible for people to get this health insurance. Where it is normal for them to have insurance, to have this accessibility. It is normal to go out through your day and feeling okay that that not an accident is going to happen, and all of a sudden, I get stuck with this huge bill. However, and another way to take into consideration that many people for preventative care, They know that the emergency room is their first visit to the doctor. Now, we know that is not the right way to go. The emergency room is definitely the last place you want to go for preventative care, just to get checked out. However, that's what people do now. They literally go. So what happens, an unpaid bill, an expensive unpaid bill goes around. However, what it really comes down to is for us to educate the general public about what it is to have insurance, what is in your insurance plan, what is available to you. One thing it is for us to get somebody enrolled into the marketplace, and another thing is for us to actually educate them over what it is to have insurance, how do you use it, what is available to you, what is this preventative care that there's no out-of-pocket cost available to you. That's very, very important as well. And to help us out, we are running this as a campaign. We are literally have boots on the ground as far as informing the general public, as well we have the in-person counselors and navigators, as we will be calling them navigators from now on. And they are literally there to help you, educate you. What is the Affordable Care Act? How does it affect you? Help you get enrolled, whether we can help you on the application, whether we can help you to see what plans are on the website, and to help more than anything is more to inform everyone. We will literally be at the libraries, we will be at the stores, we will be everywhere we need to be in order to make sure that you guys have the information about what it is and to help you every step of the way. Now, we don't want to show a wrong door policy. We do want to make sure if you have a certain issue with this policy you have a certain issue on your insurance, well, how can we help you out? Do we need to report you do we need to help you transfer you to the Department of Insurance? Do we need to help you to go to the IDPH? How do we help you resolve these issues that you're having along the way? We also have certified application counselors. Now, these certified application counselors, I know I'm throwing a lot of names out there. However, I just want to know that they're all out there to help you. The certified application counselors are literally hospitals, health organizations. Now, these are already organizations that are already receiving consumers, like the hospitals. They're already receiving patients all the time. So while you're there, you can also get enrolled into the marketplace, or whether it's aid. They will be there if you need them. So they are there for your assistance. They are there for every step of the way. We have them in this room today to help you answer questions. Now, we know the federal website has not been working as much as we would want to. One thing it is that on our first day, we received over 7.1 million people that have gone onto the federal website. Over 7.1 million. We are adding more capability onto our website. We have gotten better from no one being able to enter the website to a waiting time of 20 minutes to filling some of the applications, but we are moving forward. And we never concentrated on the month of October to actually be a day of enrollment. We have concentrated the month of October as a pure education day. Education, education, education for the whole month. Enrollment will take on in November. And we know a lot of people are just like, well, I want to go on and I want to see, and I really don't know an impulsive insurance buyer. I know people who go to the marketplace, see what their options are, step back, go home, see what their options are available to them. And yes, we do actually, and it was really funny because we actually had our first, on Wednesday we had our first marketplace buyer, and she posted on our social media page. It was great. I was like, wow, we got it right away. Here we go. So it was great. So there are people that are being signed up, and just a reminder, this is till March 31st. This is a 6-month process. But I do want to emphasize on one factor. I did hear that many of us might know, before I move on, that there is an iChip program. It's very, very important to address that. The iChip program is an insurance company set up by the government, and this is a private insurance company. However, it is expensive. It's an expensive insurance policy. It's a high-risk, pre-existing pool. And that iChip program is literally meant to drive you towards the Affordable Care Act to the end of December. Simply because now you are in a high-risk pool. However, beginning on January, that is no longer the case. That is no longer the case. You cannot be denied, nor can you be discriminated based on your premiums. So one date that I want to emphasize is December 15th. December 15th is a huge one. Simply because if for some reason and this is in order not to avoid a gap in your coverage. So if you sign up on December 14th or 15th, and you get enrolled in the marketplace, your coverage begins first day of January. Now it's very, very important because the day you signed up on December 16th or 17th or anywhere beyond that, then your coverage actually doesn't start till February. So if you do want to make sure that there is not a gap in your coverage, then you have to make sure December 15th is a big day for you. And I know we have issues over the marketplace, over getting signed up. However, we have in-person counselors here to take down your information and set up an appointment with you as soon as we are up 100%. So we do want to let you know we are there helping you, educate you, whether you have early questions now, whether you have questions of what do I need to bring with me, what information do I need, what exactly do I need. We are here to help you answer those questions as well. Very, very important. So if anything,
One quick question.
Yeah.
In the past, I used a medical insurance broker to navigate individual insurance, which was a nightmare. It seems there's no more need for an insurance broker.
no, I do apologize, and you know what, that actually brings me to a good subject, that we have opened the doors to insurance brokers. We as the state of Illinois have considered them assets to our project, to our campaign, to our enrollment, simply because when you come up to us and we get you on the marketplace and you say, okay, well, you have plan X and you have plan B. These are the options that are available to you. Now this is the copay, now this is the deductibles, and we can talk to you about your plans, but we are never going to be in a position to choose what plan is best for you. We will never be in that position. So we have opened that door because we know, and some individuals need that extra assistance. You know, they need that certain prescription drug. They need to make sure that this one plan has to be in this one doctor has to be in my network. We want to make sure he's in my network, or a hospital. We have opened the doors to agents and brokers. However, they do have to be certified with the state of Illinois. On our website, when you go and it says, do you need assistance on getcoveredillinois.gov, it's going to say, please plug in your zip code. The zip code will have available to you the navigators and the in-person counselors. You put in your zip code, it'll tell you where they're located, their phone number, and will also, in case you have if there's a special language that you want to make sure you whether it's Spanish, whether it's Polish, there are certain organizations that offer those services. But however, maybe for us, we will never choose your plan for you. Maybe we need to refer you to an actual agent and broker to go a little bit step forward. So as long as they are certified with and taking the training, they can sell you marketplace plans. They're allowed to sell you marketplace plans with no charge to the consumer. There is no charge for you. That is between whatever charge happens. That is between them and the insurance company, not the federal government, not the consumer. That is between them and the insurance company. So we are considering them an asset. So I do not recommend that you put the cross on them and move on, but however, we are considering them an asset. So I do want to open up the room. Yeah.
When a person enrolls in a program, silver,
Yeah.
and that policy is good for a year,
Yes.
and then it will be reconsidered, and
I mean, insurance
you
companies.
can redo, you can move up or down accordingly,
During out the year, you will not be moving up and down.
but there's a
Yeah.
period.
So next year, we will also have another open enrollment period. It will be much smaller though. I do have to advise everybody. It will be much smaller simply because, that's just how insurance enrollments goes. But it will be from October, it will go all the way to December. So yes, when you do go to the marketplace and you choose your plan, I mean, that's your contract between you and the insurance company. And we will, you'll choose, and if insurance companies will go up to you and try to renew it, but if you're receiving tax credits, it's important to get back at the enrollment period to receive those tax
I
credits.
understand that, it's just, it's a plan period for a year.
Yes.
It's a policy for a year.
Yep.
And at the end of that period, the premium can be raised.
There is a section in the Affordable Care Act. I mean, it could differentiate next year.
Of
Yeah.
course.
Yeah, but there is a provision in the Affordable Care Act that if a company were to raise your rates by 10%, they actually have to justify to the Department of Insurance, and it's a threshold of 10%. So for some reason, that insurance company is raising the rates for above 10%, they actually have to justify to the Department of Insurance, hey, why are you doing it? Are you providing more services in your plan? Is there a certain service that's costing more? And the Department of Insurance actually, for the first time, actually has the right to say no. You know, that's not justified. That's not justifiable. You know, because what would happen for us who have insurance is, hey, I have insurance, my rates just went up $200. But we still need insurance, right? We still need to pay for it. So we just gotta, it's literally coming out of the wallet. I forgot about your question, but we're gonna have to talk about that after. So, any other questions? Go ahead.
Health savings accounts, are those going away?
Yeah, that does not change. That does not change, that keeps going.
Okay.
So one thing I do want to emphasize, and it's a great point that you bring that up, is that the Affordable Care Act is targeted towards the uninsured. Very, very important. If you are on Medicare now, nothing changes. You keep using Medicaid. If you have employer-sponsored insurance and you like your insurance, you can stay on it. That's completely fine. Nothing really changes. If you are on Medicare, especially Medicare, if you are on Medicare, nothing changes. You keep shopping at Medicare.gov. You keep getting your supplemental plans at Medicare.gov. Supplemental plans will not be on the marketplace. They are not offered there. The marketplace is literally not in place for you. If anything, Medicare, they just grab the benefits that are coming with the Affordable Care Act. Some of the services that they're receiving now are considered preventative care, so there is no out-of-pocket cost to them. Also with Medicare is that the closing of the donut hole. The supplemental plan of Medicare Part D, what that really is to get everybody in a good view about how people are going to benefit is Medicare Part D is a supplemental plan to help you buy prescription drugs. What would happen is when you would get assistance in a certain threshold to purchase these prescription drugs. Once you reach that threshold, you have to purchase your insurance, your prescription drugs at 100% of the cost of those prescription drugs until you reach another threshold and you get assistance again. So in that gap, in that threshold where you have to pay 100% of your prescription drugs, that is what the donut hole is. Now that has been closing since 2010, and we estimate that that'll be closing in 2020. So really, it is really targeted towards the uninsured. That's what it's really bringing up to what the Affordable Care Act does. So that's a good point that you bring up. But yeah, so the account savings though doesn't change. It keeps continuing what happened. So if you have it or you want to have it, then that program still keeps going.
But you can, you can only have it if you're in a catastrophic plan right now.
Those catastrophic plans are working, they're a little bit different. We can get more, yeah.
No,
Giovanni,
Yeah.
is this based off of our 2013 income?
What the tax credits are really based on?
Not tax credits, just, you mentioned age, you know, where we live, et cetera, and income.
Mm-hmm.
And so, is that going to be based off of, when I answer that question, our 2013 income? Because he's self-employed, I won't know exactly what our income is until we do taxes.
Yeah, no, and that's great.
Next March.
And actually, well, it's really based off your 2014 going forward. It is going to ask you what your income is, and it's going to, you know, when you go on the application, ask you, is this income that you're receiving every month? Are you receiving this for the year? And that's a very good point to bring up, simply because yes, you're basing this off of your tax, and more importantly, your tax credit is based off, and your application is based off moving forward. And this comes into a little bit more detail. So let me know if I get you lost a little bit. So it is moving forward as far as what everything is. So let's just say you are telling the application, this year I'm going to earn $30,000. That is what we're earning together, $30,000 moving forward. However, maybe at the end of the year you end up reporting $35,000, but you got a tax credit for 30, right? So when you file your taxes and you got 35,000 and you got that tax credit for 30, you will have to pay back that tax credit that you received above a little bit more. And however, maybe you said you were going to earn 35, but you really got 30. So maybe more tax credits will be available to you. The tax credits will be available to you when you file your tax at the end of the year.
Okay.
And we understand that certain individuals who fluctuate in their income, and that's exactly why the option of how do you want to receive your tax credits is important. Because if you're not too sure about what your income is moving forward and your income fluctuates heavily, maybe you're better off just purchasing that premium and paying for it every month and just receiving that tax credit at the end of the year. So that's why you're always going to have that question. And it asks you on the application, it asks you, hey, if I know that my income is fluctuating, then I agree or I disagree. It tells you, do you agree that if your income is fluctuating, I will keep in touch with the marketplace, and it gives you the number. Because if you are receiving it early, and all of a sudden you're like, you know what, I know that this year my income is a lot higher. I'm earning a little bit more money, especially with self-employed individuals. You report to the marketplace and you let them know, you know what, I think I'm going to make a little bit more. They'll adjust your tax credit for you right then and there.
Okay.
So it's very, very important to take that consideration. You have a question?
No, I was.
Oh, okay. So, questions? Go ahead.
The marketplace consists of what, many insurance companies?
Yeah.
And they'll all charge the same premium?
No, they will not charge the same premiums. Now, a lot of individuals, there's a lot of miscommunication out there that, hey, you know what, these are all government plans. I've heard about Obamacare. I don't know where that comes from. Now, these are all private plans. In the back table, we actually have a list of what these plans are, and these are the plans that we already know today. These are the Aetnas, these are the Blue Cross and Blue Shields, these are the Humanas. These are all private plans, and they're all working the same way as if you purchase a private insurance plan. It's very, very important. So they're all going to differentiate. Now, it's very, very important because they're all going to differentiate in prices, in premiums, deductibles, co-pays, networks. It's the same way. Insurance is working the same exact way. The only thing is that the marketplace creates is that accessibility and that affordability. And it's very, very important for me to let everybody know, theoretically speaking, if you see a plan in the marketplace and the private market, an insurance broker who is not licensed, and they can sell you the exact same plan as the marketplace. However, the problem is the marketplace, the benefit of it is the tax credit. You can only get the tax credit on the marketplace. If you were to go to a broker and he's not licensed, and you buy the exact same plan, there is no tax credits available to you. So one of the benefits the marketplace it has these tax credits, so it has to come from a marketplace plan. Good to go. All right. Well, we have in-person counselors here to answer any kind of questions you guys may want. Please feel free to leave your information. They will call you. They will set up an appointment with you as soon as the marketplace is up and going at 100%. And we will be more than happy. I want to say thank you for everybody for attending. Yeah.